So, hi friends, I am Dr. Anshul Bansal again joining you on this Unacademy platform. As you all know, I am here to guide you through your subject of orthopedics for your preparation for NEET PG and other competitive examinations. Here, we'll not only focus on the competitive examinations, but we'll focus also on we'll study orthopedics in depth so that you can not only crack your competitive examinations, but it will be helpful for your professional or university examinations also. And also in this journey we will give a special emphasis on clinical based questions, the x-rays and the images, so that you can learn them properly and also you can crack your questions for NEET PG, because in recent days there is a shift towards more clinically based questions, and also it will help you in the coming next pattern examinations. In today's lecture, we'll complete the remaining lower limb. So it is lower limb part 2 orthopedics. So here we'll study about the fractures of the leg bones, that is tibia, fibula, fractures of the ankle, and the fractures of the foot bones, the tarsals, metatarsals, as well as the toes of the foot. Okay, so let's start today's lecture. Let's crack NEET PG with Unacademy. Okay, so before starting the lecture, I would like you to guide you through a paid subscription plans, okay, which are available on Unacademy for the NEET PG. The first one that we have is the Plus subscription. The Plus subscribers will get live access to both live and recorded classes with access to a QBanks, both of which are done by our esteemed faculties, the top educators of India for NEET PG, as well as you will be given access to live tests and quizzes, plus you can log into multiple devices so that you can study on the device of your choice at any time. Plus, for the subscribers of 12 months or more, we'll be providing the hard copies of the notes also. So you can apply for this code and for this course and use this code to get extra 10% off. Okay, now for the iconic subscribers, we have second one, that is the iconic subscriber, which is the best subscription plan. In this, the things that I have explained you earlier, apart from that, you'll also get the prep ladder, all of the prep ladder, its QBanks video lectures, as well as its rapid revision courses. Plus in Unacademy, what you will get extra, you will get extra live batch wise classes by our top educators, as well as these batches and classes are structured in a strategic way so that you can build your basic concepts about every subject first, then you can read in depth about the subject and the topics, and we have structured it in such a way so that you can correlate with the other subjects and topic for a better understanding. Okay, you'll have access to the live test and all of our QBanks, and the subscribers will get an individual assessment of every test so that they can find where they are lacking behind, of which subjects, of which topics they need to work more. Okay, so you can apply for this course and you can use this code to get extra 10% off. Okay, now keeping in mind the various groups of examinations of and various students who will be focusing on different examinations, like for FMG graduates, for the next aspirants, and obviously for the NEET PG, we have started dedicated batches for all the courses. Okay, so you can apply for these courses and use this code to get extra 10% off. Okay, now as you all know, NEET PG for 2021 is scheduled next month only. Exactly 1 month is left only now. So keeping in mind, we have started a NEET PG 2021 1 month package in which you will get access, and in which you will get all of the essential last minute tips, tricks, high yield questions, important topics, and grand test and quizzes, all of it you'll get. So please go for this 1 month package. It is the best package for the last time revision for all the subjects, and you can apply this code to get extra 10% off. And as I have repeated it many times, grand test देना बहुत 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 ज़रूरी है. At least 3 to 4 grand tests per week, and don't just give the grand test. See its answers, okay, and give it like you are sitting in examination, so that you'll get the feel of the examination, you'll get used to it, and also it will help in your time management. Okay, so read the theory and answers of every question, and even if the wrong option, you don't know anything about the wrong option, just do not leave it like that. Read about it in the explanation part. So we have started a grand test series also, and the schedule is given here, so please go for it, and you can use this code to get extra 10% off. We are also running a special limited time period offer, in which if you'll buy any plan for 12 months, you'll get 2 months of the plan absolutely free. And also keeping in mind our MBBS graduates, and for their next examination, we have started a important 4-year subscription courses, and we are giving a limited time period heavy discount for it, in which the iconic subscription is available for only 75,000 for the entire 4 years. So please go for this plan also. Now, as you can see, as you increase the duration of the course, the per month cost of the course decreases significantly. So I would strongly recommend you to go for subscriptions of longer duration. Okay, and also we have special classes, and for this you have to download the Unacademy Learners app and subscribe it using my code, and both of which are absolutely free. Special classes special क्यों होती है? Because in this COVID era also you will get a live classroom like feeling, where you can interact with your learner. You will be you can participate actively. You can just raise your hand, solve your queries there. You can participate in the polls, and the best part is that you can listen to the lecture anywhere, anytime. You need to just open the app. Also, you will be provided the lecture notes in the digital format of special class. Also, we are running a special bugs bounty program, in which if you find any inappropriate content in any of the slides or lectures of any of our educators, you can contact a team in the link given below, and if it is found correct, you will be rewarded with handsome prizes. Okay, so let's start with today's lecture. Okay, and if you have any doubt, you can just type in the live chat box, and I'll try to solve them. Okay, so let's start. We have covered the fractures of femur and patella already, and in today's lectures we'll start with the tibia and the fractures of the tibia, that is the proximal tibia or the tibial plateau fractures. Okay, these are more common due to large violent forces, like in the two-wheeler accidents when one lands on the knee. Okay, ऑब्वियसली बात है, प्रॉक्सिमल टिबिया तो नी पे जब फोर्स लगेगा तो देयर विल बी फ्रैक्चर. दे कैन बी डायरेक्ट हिट like we have discussed here, or they can be indirect like twisting or bending forces. Okay, like varus or valgus forces. Now, most commonly tibial plateau fractures में एक इम्पॉर्टेंट क्वेश्चन बनता है कि इसका क्लासिफिकेशन एंड इसके टाइप्स. तो बेसिकली यू हैव टू जस्ट रिमेंबर द नेम, दैट इज टिबियल प्लेट्यूज आर क्लासिफाइड बाय Schatzger types. Okay, Schatzger type is for the tibial plateaus. See in this image, you can see there are 6 categories according to the Skatsger classification, and here you can see 1 2 3 4 5 6, and 5 and 6 are commuted and most dangerous types. Okay, you just need to remember one name, that is Skatsger classification for tibial plateaus. Now signs and symptoms are the same as any other fracture. You have to correlate the history given by the patient with the signs and symptoms like pain, swelling, crepitus, deformity. Straight leg raising test will not be possible. Okay, and then correlating with this findings to x-rays and CT scan findings. And mind you, tibial plateau fractures are intra-articular. So intra-articular है तो क्या होगा? A very precise and complete reduction is possible, is necessary, very necessary. Okay, so keep in mind, and you have to do the CT scan pre-op so that you can plan your surgeries very well. Okay, so you can see tibial plateaus. This is a tibial plateau fracture. Okay, in the CT you can see, here also you can see, and it is fixed by ORIF, internal fixation, with the help of plating, as you can see in the diagram. Okay, now remember one thing, that tibial plateau fractures are almost often associated with injuries to the knee ligaments. Okay, and अगर यहाँ टिप पे फ्रैक्चर होगा, so remember ACL इंजरी के चांसेस बहुत बढ़ जाते हैं, एंटीरियर क्रूशिएट लिगामेंट. ओके, this is the Skatsger type. You just need to remember the name कि tibial plateau fractures में काम आते हैं. So treatment, same treatment guidelines if it is closed and undisplaced. Okay, then you can go for the conservative management by slab and the subsequent cast for 4 to 6 weeks, है ना. But it will require very good physiotherapy, and the chances for joint stiffness and arthritis are very common. But if it is displaced even slightly, or if it is compound, you have to go for the surgical procedures for accurate reduction, and it is mostly done by ORIF, that is open reduction and internal fixation, with the help of plating that we have seen in the previous x-rays. And if it is compound, you have to go for the debridement, then heal the wound, and when the infection subsides, you can go for the definitive surgery. Okay, this is your tibial plateau fractures. Now dislocation of the knee. See, elbow, shoulder, hip joint, we have discussed the dislocation of every joints जिसके कांटेक्ट में, मतलब that we are discussing till now. But the most rare, I can say, and also the most rare as well as the most violent and the most worst dislocation is that of the knee. Because if knee is dislocated, the important ligaments like the cruciate ligaments, the menisci and all, they will get teared. Okay, and mostly such fractures are associated with vessel and nerve injuries, because many important vessels and nerves go through the knee joint, especially from the popliteal fossa. Okay, so they are very high chances of injury to these structures also. Okay, so there is a major damage to the joint, and as we have discussed, most common artery will be the popliteal artery, which will be affected. Treatment is reduction, but many a times, yeah, often always, you need the surgery or open reduction to reduce a dislocated knee joint. And if you are able to reduce it by closed manipulation, then you have to keep it immobilized for 3 to 4 weeks in a cylindrical cast, because in this the ankle is free. Okay, so as we have discussed in recent times, we have to go for the operative treatment because it is a very important joint and proper reduction is necessary. And then when the knee is reduced, you can go for the ligament reconstruction by arthroscopy also. See here you can very well appreciate the knee joint dislocation, very well appreciated here. Okay, now see here you can see in the normal knee, here you can see the attachment of important ligaments. This is patella. Here you have the lateral collateral ligament on the fibular side, that is the lateral side. On the medial side you have the medial collateral ligament, the menisci on the articular surfaces, and anterior post cruciate ligament and posterior cruciate ligament. Okay, now disruption of the extensor apparatus, like we have discussed in the class yesterday only, the extensor mechanism of the knee consists of quadriceps femoris of the anterior compartment, followed by its tendon, then it attaches to the patella, and patella के medial and lateral sides पे you have the patellar retinaculum, and this below patella you have the patellar tendon. So this entire thing forms the extensor mechanism at the knee joint. Okay, so sometimes the disruption of the extensor apparatus जो होता है, it may result in tearing of the quadriceps tendon from its attachment on the patella, like we have discussed. Okay, or its attachment of the patellar tendon from the tibial tubercle can also get detached. Okay, so most common muscle or tendon which is injured in the extensor apparatus disruption or injury is the quadriceps muscle, and it is most commonly due to the sudden contraction of the quadriceps, which will lead to the fracture of patella, like we have discussed yesterday. Okay, and when these tendons and alag muscles or tendons are injured, you need to repair them operatively, most commonly by arthroscopy. Okay, now dislocation of patella. सबसे पहले ये ध्यान रखना है कि पटेला डिसलोकेट्स लेटरली. ओके, पटेला हमेशा कहाँ पे, लेटरली या फिब्युलर साइड में डिसलोकेट होगा. एंड इट कैन बी ऑफ 3 टाइप्स: acute, recurrent and habitual. What is acute? Acute is less than 3 weeks, subacute is more than 3 weeks. Okay, it is acute. Recurrent is if especially in the adolescent population में recurrent ज़्यादा होता है कि बार बार हो जाए, it is recurrent. And what is then habitual? Habitual is every time when you flex the knee, every time on flexing the knee there is dislocation, है ना. जब भी आप knee को flex कर लोगे there will be dislocation, so it is called habitual dislocation of patella. Now as we have discussed, acute dislocation of patella या patella fracture जो है उसका most common reason क्या होगा? It will be sudden contraction of the quadriceps when the knee is flexed or semi-flexed. And when the patella is dislocated, तो the extensor mechanism काम नहीं करेगा knee का, so the patient will not be able to completely extend the knee. Okay, and it is also very common that whenever the patella will shift laterally or dislocate laterally, obviously the medial condyle of the femur will become more prominent. Okay, so sometimes the dislocation can relocate spontaneously, and if it occurs, you have to just immobilize the patient for 2 to 3 weeks in a cylindrical cast. Okay, but even after relocation, you can have marked tenderness on the anterior medial side of the knee. Okay, now sometimes क्या होता है, जो पटेला का अटैचमेंट विद द फीमर, पटेलो-femoral joint जो होता है, there is a small tip like portion of the patella attached to the femur. Okay, that is called the osteochondral part of the patella. Okay, that is called the osteochondral part of the patella. Okay, here in this diagram, here you can see this is the osteochondral part of the patella. So if there is sudden quadriceps contraction and or violent quadriceps contraction, sometimes that bone piece which is covered with this cartilage, articular cartilage, which is called the osteochondral fragment, there can be avulsion fracture of it associated with the avulsion fracture of the femoral condyle also. Okay, so अगर ये हो जाएगा, so this will result in repeated episodes of pain, swelling and sensations of a loose body there, because the patella will become loose. So arthroscopic removal करना पड़ता है. See, here you can see this is your healthy extensor mechanism, as we have discussed, the quadriceps, then the tendon, then the patella, then the patellar tendon. Here you will have the retinaculum. Okay, subluxated agar incomplete dislocation hai, and here you can see there is complete dislocation, and you can see the trochlea here, empty trochlea of the femur. Okay, see here you can see dislocated patella, and here you can see this is your patella dislocated, this is your patella dislocated, and towards the fibular side, that is lateral dislocation. Okay, now patellar dislocations के लिए you have an important index or a ratio. Just remember its name, and it is called the Insal-Salvati ratio. The Insal-Salvati ratio is a very important term. Just remember that it is used for patellar dislocation, and normally it is equals to 1. Now what it is basically a ratio of the length of the patellar tendon. This is the length of the patellar tendon, first part, upon second part, that is the length of the patella. Okay, and it is used to determine the patellar height. It is used to determine the patellar height. So patellar tendon की length and patella की length का ratio used for determining the patellar height is the Insal-Salvati ratio or index. Normally it is 1. Okay, now if patella is dislocated upwards, that is towards the femur, it is called patella alta. जैसे and opposite will be baja. So A पहले आएगा, so ऊपर वाला यानी femur की तरफ will be patella alta, और हाई पटेला और पटेला बाजा, that is नीचे dislocation हो जाएगा, that will be low lying patella. So in patella alta क्या होगा, this ratio will be more than 1, and in patella baja this ratio will be less than 1. Okay, समझ आया? If you have any doubts. Yes, hi Yash. Sir, is there any possibility of questions for dislocation? I guess for knee dislocation there is a rare possibility, but yes, there is a possibility of patellar dislocation wale questions. Okay, so पटेला डिसलोकेशन में इंसल सलवती रेशियो लेटरली होगा. एक्सटेंसर अपैरेटस का मैकेनिज्म एंड इट्स स्ट्रक्चर्स यू शुड नो. एंड अक्यूट हो गया. नाउ वील कम एंड इट्स का ट्रीटमेंट ऑफ अक्यूट जस्ट लाइक रिलोकेट कर दो बाय क्लोज मैनिपुलेशन and then followed by a cylindrical cast for 3 to 4 weeks, and if it is compound you have to go for the surgery, and if the reduction is not proper or not surgery not proper, or you are unable to reduce it, then you have to go for the open reduction. Now recurrent, as we have discussed, after the first episode of dislocation, especially in the adolescents, the dislocation tends to recover with more and more ease. Okay, so the reasons क्या होते हैं? reasons चार reason होते हैं. सबसे पहले जो articular cartilage या joint capsule है या जो joint है वो पूरा ही lose हो जाए, that is lax हो जाए, or if there is small patella, or if there is genu valgum deformity in which laterally हो जाएगा. ठीक है, valgum will be laterally as we have discussed, LRI. So if there is genu valgum deformity and patella alta, ठीक है, so patella baja and patella alta में से recurrent dislocation of patella के चांसेस किस में ज्यादा होते हैं? इट इज patella alta. ओके, एंड ऑल्सो जेनु वेरस या जेनु वेलगम में से जेनु वेलगम के अंदर. ओके, इसको ऐसे याद रखो कि पटेला मोस्टली लेटरली डिसलोकेट होती है, सो जेनु वेलगम होगा, सो देयर विल बी चांसेस ऑफ रिकरेंट पटेलर डिसलोकेशन. ओके, नाउ ट्रीटमेंट ऑफ रिकरेंट पटेलर डिसलोकेशन में आपको मेनली क्या होता है, जो इसका कॉज है वो फाइंड करके उसको ट्रीट करना है. एंड मोस्ट ऑफनली देयर इज अ इंजरी or you have to repair or reconstruct an important ligament in the extensor mechanism of the knee, and that is the patellofemoral ligament. So इससे भी याद रह जाएगा कि alta will be more associated with recurrent dislocation. Okay, and कौन सा patellofemoral ligament? Medial patellofemoral ligament reconstruction is required, and this operation is called as the Hauser operation. This operation is called as the Hauser operation. So याद रखो recurrent में 4-5 things. Firstly, adolescence में ज़्यादा होगा, more and more ease के साथ होता जाएगा. Secondly, alta के साथ more commonly associated होगा. alta is patella alta is ऊपर, so patellofemoral ligament का रिकंस्ट्रक्शन करना पड़ेगा, दैट टू मीडियल वाला, एंड इट इज कॉल्ड एज हाउजर ऑपरेशन. एंड लेटरली होता है डिसलोकेशन, सो जेनु वेलगम के साथ भी ज्यादा एसोसिएटेड होगा. Okay, now what is habitual dislocation? As we have discussed, whenever you flex the knee, the patella will get dislocated. This is called as habitual dislocation, and generally young adults and children में होता है, and the etiology is same as that of the recurrent dislocation, that is legs joint, genu valgum, patella alta and small patella. Okay, but apart from that patellofemoral ligament, यहाँ पे क्या होगा, the quadriceps जो होता है उसका जो वास्टस लेटरालिस वाला कंपोनेंट होता है, that will get contracted and that gets shortened, which may result in an abnormal lateral pull on the patella when knee is flexed. So अब कुछ तो नया होगा ना हैबिचुअल में. तो हैबिचुअल में एक नई बात क्या है? हैबिचुअल में नई बात ये है कि पटेलोफेमोरल लिगामेंट के साथ में क्वाड्रिसेप्स का एक कंपोनेंट, दैट इज वास्टस लेटरालिस, इज आल्सो इन्वॉल्व. बस इतना ही आपको याद रखना है, बाकी ट्रीटमेंट इज सेम, है ना. आर्थ्रोस्कोपी एंड ऑल के थ्रू यू हैव टू रिकंस्ट्रक्ट द लिगामेंट. ओके, नाउ देयर इज एन इम्पॉर्टेंट word you can say for a NEET PG, and just remember that word, that is check Karen or chakrin effect, okay, or mechanism. This chakrin effect is associated with patellar dislocation, and that too habitual dislocation, okay. And what is this effect? It helps to prevent redislocation. And how? इसमें भी क्या काम आता है? That quadriceps tendon और patellofemoral ligament जो होता है, इसमें क्या होता है? It forms a tight covering the around its attachment with the distal femur that helps in prevention of the dislocation. So this is chakrin effect, okay. Now it is very important and sometimes very confusing also to remember the different muscles in different compartments of the leg. So please go to your anatomy notes. It will take you just 5 minutes to read it. वैसे आई एम रिवाइजिंग इट फॉर यू, सो बार बार भूलो नहीं, इसके लिए जस्ट टेक अ स्क्रीनशॉट और डाउनलोड इट फ्रॉम द गूगल एंड जस्ट कीप इट इन योर गैलरी एंड रिवाइज सच 50 to 100 images daily whenever you get time, and it will take hardly 5 minutes, okay. And it is the best way to revise that even I used to follow, okay. So रिमेंबर, सबसे पहले अपन आएंगे एंटीरियर कंपार्टमेंट पे. तो अपर लिम में एंटीरियर कंपार्टमेंट जो होता था, अपर लिम में एंटीरियर कंपार्टमेंट वाज फ्लेक्सर कंपार्टमेंट. हियर it is anterior compartment is the extensor compartment, and extensor compartment for the knee and flexor for hip, okay. एंटीरियर कंपार्टमेंट में नी के लिए एक्सटेंसर्स होते हैं एंड हिप के लिए फ्लेक्सर्स होते हैं, ओके. सो नी के लिए एक्सटेंसर्स जो होते हैं, एज वी हैव रेड, इट इज क्वाड्रिसेप्स फेमोरिस, एंड हिप फ्लेक्सर्स इन द एंटीरियर कंपार्टमेंट आर द sartorius, pectineus, psoas major and the iliacus, and it is supplied by the femoral nerve, and it is supplied by the femoral nerve, okay. Just remember anterior compartment femoral nerve से supply होती है, okay. and ये muscles होती है ना. quadriceps जो होते हैं, quadriceps femoris में there is 4 group of muscles: vastus medialis, vastus lateralis, vastus intermedialis or intermedius, and rectus femoris, okay. Now posterior compartment, the posterior compartment जो होता है that is just इसका opposite, कि upper limb में तो posterior compartment was the extensor, तो यहाँ पे flexor होगा, and flexor for the knee and extensor for the hip, and it comprises of the hamstring muscles supplied by the sciatic nerve, ओके. तो हैमस्ट्रिंग में भी 3 मसल आती है. फर्स्ट इज सेमी मेम्ब्रेनस, सेकंड सेमी टेंडिनस, एंड द थर्ड इज बाइसेप्स femoris. It is about the posterior compartment, the hamstring. Now the medial compartment will be the hip adductors supplied by the obturator nerve, and it consists of the adductor muscles like adductor longus, adductor brevis, adductor magnus का adductor part, and the gracilis, okay. So remember this, important है ये, okay. Now there is a special term known as internal derangement of the knee, and what does it denotes? It denotes, नाम से पता चल रहा है, it denotes any injury to the ligaments or the tendons of the knee joint, ओके. सो नॉन बोनी इंजरीज आएगा यहाँ पे, ओके. तो मेनिस्कस, द लिगामेंट्स, द टेंडन्स और द पटेलोफेमोरल प्रॉब्लम्स आर ऑल कलेक्टिवली क्यूमुलेटिवली कॉल्ड एज द इंटरनल डिरेंजमेंट ऑफ द नी. एंड एमआरआई सीटीज, एमआरआई उसमें भी द ट्रीटमेंट, सॉरी, द इन्वेस्टिगेशन ऑफ चॉइस एंड ट्रीटमेंट ऑफनली यू रिक्वायर आर्थ्रोस्कोपिक सर्जरी फॉर द रिकंस्ट्रक्शन, ओके. Now we'll come to the fractures of shafts of tibia and fibula, and mostly क्या होता है, like fractures of the both bone forearm, अल्ना के साथ रेडियस का फ्रैक्चर बहुत कॉमन होता है, सिमिलरली टिबिया के साथ फिबुला का फ्रैक्चर्स भी बहुत कॉमन होता है, एंड सो इट इज कॉल्ड फ्रैक्चर्स ऑफ बोथ बोन लेग. ओके. नाउ एक और इम्पॉर्टेंट बात होती है कि these fractures are very common, especially in the road traffic accidents like the bumper injury and all. Okay. And tibial fractures is very common because the tibia bone, as you can feel also on your shin, it is a very percutaneous bone. Okay, यहाँ पे ही फील हो रही है, तो ऑब्वियसली बात है फ्रैक्चर के चांसेस ज्यादा होंगे, एंड मोस्ट ऑफन देयर इज अ वायलेंट फोर्स that is associated with it, so it will lead to compound and open fractures, often bone exposing fractures, which are very hard to treat. Okay. And as you all know, tibia is a major weight bearing bone of the leg. ओके. एंड फिबुला जो होती है वो लेस इम्पॉर्टेंट बोन होती है, और इसके बिना भी यू कैन वॉक, सो इसलिए फिबुला इज ऑफन यूज फॉर क्राफ्ट्स एंड फॉर सर्जिकल लैंडमार्क्स, बट फिबुला हैज more blood supply due to more attachment of the muscles here, so remember this. Okay, so the characteristics, one first characteristic, it is a subcutaneous bone, and we have already discussed it, and this results in increased chances of fracture of the tibia, that too their open infected fractures. Here you can appreciate in the image very easily fractures of tibia with fracture of fibula. Okay. Now there is a precarious blood supply, especially in the distal 1/3 of the tibia जो होती है, वहां पे क्या होता है, डिस्टली क्या होता है, सारे जो मसल्स होते हैं they convert into the tendons for their insertion. So distal tibia में precarious blood supply होती है, there is very less blood supply there, only basically periosteal and medullary blood supply. Medullary blood supply is the major blood supply. So यहाँ के जो distal tibia fractures होते हैं, they are hard to heal because of this precarious blood supply, and यहाँ के compound injuries or open injuries are more difficult to treat. Okay, so there is high possibility of delayed and non-union. Okay, but as we have discussed earlier, the fibula as opposite to it have many muscular attachments, and thus it have a rich blood supply. Okay. Now another precarious thing and important thing is there are hinge joints both proximally and distally. Okay, knee and the ankle. So even if there is small degree of misalignment or malalignment or angulation or malrotation, so it will lead to decrease in the range of motion or movement of both these joint. फिर आप बोलोगे कि सर फीमर में भी तो ऐसे हो सकता है. फीमर में ह्यूमरस में इतना ऐसा नहीं होता है, because the proximal joint is a ball and socket joint which provides a more range of movement or motion in all the directions. So इसकी वजह से क्या होता है, that little deformity जो होती है वो छुप जाती है. Okay, that can be concealed, but here both are the hinge joints, so even a little malalignment or malrotation or angulation will hamper the day-to-day activity of the patient. Okay, now mechanism we have discussed. हर इंजरी जो होती है बोन की, उसमें mechanism generally same ही होता है. डायरेक्ट इंजरी by direct force like we have discussed, or indirect force by twisting, or the varus or valgus force, or the bending force, which will result in more spiral fractures, है ना, spiral fractures or oblique fractures. Okay, so this is the mechanism. Now patho-anatomy. So तीन पार्ट्स में डिवाइड कर देते हैं अपन इसको भी, अपर वन थर्ड, मिडिल थर्ड वन थर्ड, डिस्टल वन थर्ड. डिस्टल वन थर्ड एज द पुअरेस्ट prognosis and why more prone to the complications, why we have discussed this all. And occasionally there can also be only a single bone fracture, that is isolated tibia or fibula fractures. ओके, डिस्प्लेसमेंट, एंगुलेशन, रोटेशनल कैसा भी हो सकता है, एंड देयर कैन बी स्पाइरल एज वेल, oblique or that transfers or commutated, anything. Clinical features and radiological features we have discussed many a times. हिस्ट्री जो पेशेंट देता है उसको आपको कोरिलेट करना है विद द पेन एंड swelling and other clinical features of a fracture, and then you have to correlate all of this with the X-ray and the CT scan findings. Okay, now the treatment is just like any other treatment of fracture of long bone, that if it is closed, and especially in the children, you can go for the conservative management with the GT slab or the above knee slab, then continue it for the cast. but यहाँ पे cast आपको लंबा लगाना पड़ता है, at least 8 to 12 weeks के लिए. Okay, if you're managing it conservatively without weight bearing. Okay, and if it is open or committed or reduction is not proper, you have to go for the internal fixation. And mostly इसमें क्या होता है, you go for close reduction internal fixation crimped by nailing, and that to interlock nailing, and it is the treatment of choice nowadays even for closed fracture of tibia. If there is isolated fracture of fibula na, especially proximal fibula or the middle one third or the distal one third, you don't have to do anything. In here, conservative management is the treatment of choice. Okay, so isolated fibula fracture में the treatment of choice will be conservative management by slab and cast. Okay, see here you can see this is a interlocking nail tibia, and here you can see callus is formed, healing is done, and you can see bone कितने अच्छे से जुड़ी है. Okay, so this is interlocking nail tibia with the proximal and the distal screws. Okay, now open fractures. So open fractures की एक बहुत ही important grading होती थी that we have studied, and that grading was modified Gustillo Anderson grading. Okay, modified Gustillo Anderson grading, जिसमें we have divided compound injuries into 3 grades 1, 2 and 3. फर्स्ट में 1 सेंटीमीटर से कम होता था क्लीन वुंड होता था, सेकंड में डर्टी वुंड हो सकता है मोर देन 1 सेंटीमीटर, एंड थर्ड जिसमें बोन एक्सपोजिंग और हाईली नेक्रोटिक एंड और न्यूरोवैस्कुलर इंजरी है, सॉरी तो ये सब वाज ग्रेड 3 फ्रैक्चर. सो ओपन फ्रैक्चर जो होता है उसका जो ट्रीटमेंट होता है वो कैसे डिसाइड होता है. सबसे पहले इफ देयर इज ग्रेड 1 फ्रैक्चर ना, जस्ट डू द डिब्राइडमेंट और क्लीनिंग एंड ड्रेसिंग, and then you can go for close reduction and cast. Okay, and you can make a window in the cast for dressing. If it is grade 2, you have to debride the the wound, give antibiotics and put it in the cast. Window रखो cast के अंदर, proper dressing करो है ना. And the fractures if undisplaced or non-united, you can go for the definitive surgery. Now grade 3. Grade 3 में first of all you have to do the debridement. Okay, first of all you have to debridement and close if possible, but if the bone is exposing and closure is not possible, you have to leave it as such. And generally हम बोलते हैं कि infected wound अगर है तो close नहीं करो, and if closure आ रहा है तो just put tag sutures, मतलब proper closure नहीं, put sutures, not so tight, very loose sutures, that too at a appropriately larger distance from each other, just tag sutures लगा, है ना. Then debridement करने के बाद external fixator लगा दो to keep the bone fragments in alignment जितना possible हो सके. See, this is an external fixator. Okay, here the closure has been done, primary closure, and then you transfer the patient to the plastic surgery. There the wound care is done, and proper flap or graft, लेकिन नहीं, skin you have to put on the exposed part, है ना. And when the infection subsides and this open fracture becomes closed after like 2 to 3 months, you remove the fixator and then you go for the definitive surgery. And the definitive surgery can be graft with internal fixation, or as we have discussed, Ilizaro technique, Ilizaro ring fixator. Okay, so this is how you manage a compound fracture. So compound fractures, as you can see, are very difficult to manage. Okay, इतना बड़ा पूरा you have to follow the proper course, and it is very cumbersome for the patient also. Okay, now technique for close reduction, ये ध्यान रखना, टिबिया या लेग बोन के रिडक्शन में आप क्या करते हो, the operation table और नॉर्मल टेबल जो होता है उस पे पेशेंट को सुपाइन पोजीशन में लेटा देते हो. देन जो अफेक्टेड लिम्ब होता है, you keep the affected limb hanging down from the table with the knee joint flexed, है ना. Then one person holds the knee joint like this. See, if it is your leg and this is your foot and this is your thigh, so knee joint को ऐसे टेबल से नीचे हैंग कर देंगे. One person will hold the knee joint here to give the counter traction, and the other person will sit on a stool नीचे, and then he will give traction, and by manipulation he will closely reduce the bony fragments. And जब वो reduce हो जाएगा, you can feel the contour at the shin of the tibia, and जब वो reduce हो जाएगा, he'll hold it in the reduction, and then you'll put the slab or cast there. सबसे पहले below knee लगाते हैं ताकि reduction hold हो जाए, and जब that dries, you convert that into the above knee cast or slab. Okay, so this is how you manipulate the leg bone fractures by closed reduction. Okay, but now sometimes even after closed reduction there is wedging. Wedging क्या होती है? See, this is your tibia, and this is your tibia, and this is your fracture, like this. But sometimes after reduction क्या होता है? There is a small angulation here. Okay, there is a small angulation here that is called as the wedge, and this will hamper the movement of the patient later. Okay, see here, you can see there is wedging here. So wedging का जो concave side होता है, that is this side, यहाँ से you open the slab, you cut the slab like this, and you put, and then you reduce this wedged portion of the leg bone. So sometimes after fracture has been reduced and the plaster applied, check x-rays में a little angulation मिलता है आपको fracture side में. So instead of cutting open the entire plaster and reapplying it. Just cut the plaster circumferentially at the fracture line, and then the angulation is corrected by forcing open the cut on the concave side of the angulation. Okay, as we have seen. And जब fracture sticky हो जाता है, like after 3 to 4 weeks or 2 to 3 weeks, basically if you have to form कि sticky कब होता है, तो sticky 2 to 3 weeks में हो जाता है normal bones. बट जो लेग बोन्स होती है, एज वी हैव डिस्कस्ड, उनको कास्ट में भी ज्यादा टाइम तक रखना पड़ता है, तो 5 to 6 weeks for the long bones. And when it becomes sticky, you can convert the above knee cast into a below knee cast, special cast, which is called as the PTB, patellar tendon bearing cast, in which you cut that cast circumferentially around the patella so that the patient can walk and can bear the weight, and the extensor mechanism of the knee joint, the patella, is intact. Okay, and when after like 6 to 7 weeks के बाद you go for the PTB cast, and after 8 to 10 weeks when you see that callus has formed and hold आ गया है, then you can remove the cast and just prescribe a brace, and so that it gives a support, additional support for few more weeks. Okay, now role of operative treatment, as we have already discussed, internal fixation is necessary if थोड़ा सा भी mal alignment हो. ओके, सो इंटरनल फिक्सेशन डिवाइस प्लेट और नेल दोनों हो सकती है. मोस्ट प्रिफरेबली वी गो फॉर द नेल, बट प्रॉक्सिमल बहुत है या डिस्टल बहुत है या बहुत ज़्यादा कम्युनेटेड है, यू कैन गो फॉर द प्लेट ऑल्सो. Okay, now complications, delayed and non-union, and we have already read that it will be most common in the fractures of distal 1/3 of tibia because of its precarious blood supply, है ना. And if it is in delayed union or non-union, you give at least like 5 to 6 months, and तब भी नहीं हो, you can go for the bone grafting and the internal fixation. अगर nail है non union में, you remove the nail, or with nail in situ you can go for the bone grafting and then again immobilizing the patient. And if the nail is not in situ, or even after grafting it is not possible, you can go for the grafting and plating, or you can go for the Elizaro ring fixator. Okay, see, the most important factor responsible for delayed and non-union is the precarious blood supply. We have discussed, and other factors like if there is loss of fracture hematoma. क्या होता है, कोई भी फ्रैक्चर होता है तो वहां पे एक हेमाटोमा बन जाता है, and that hematoma जो होता है that helps in the fracture healing. And also sometimes अगर आपको close reduction करना है तो you can give anesthesia in that hematoma, that is called as the hematoma block, and उससे after giving that hematoma block you can reduce or closely reduce the fracture line without causing pain or misery to the patient. So if there is loss of the fracture hematoma like in open injuries, okay, there are chances of non-union, or if there is infection. Okay, and if there is delayed union, non-union, patient will not be able to bear the weight of the body and walk. So treatment जो होता है, we have already discussed by bone grafting with or without internal fixation. Nailing with bone grafting we have discussed, and there is a special type of graft which is used, which is called as the femister grafting, which is called as the femister grafting. Okay, so femister grafting में क्या होता है, it is useful for selected cases of malunion or delayed union, not malunion, sorry, delayed union of tibia fracture. इसमें the fracture has to follow certain the fracture has to follow certain indications for going for the femester grafting. And what are these? First of all, fracture should be sticky. There should be fibrous mesenchymal cells or fibrous tissue around the fracture. Okay, and there should be no mobility or minimum mobility at the fracture site, यानी fibrous union हो चुका होता है. Okay, alignment should be proper, and also the knee joint should have good range of movement. फाइब्रस यूनियन हो जाना चाहिए, यानी फ्रैक्चर साइड में मोबिलिटी नहीं होनी चाहिए, नी जॉइंट का मूवमेंट सही होना चाहिए, एंड देयर शुड बी नो माल अलाइनमेंट. इफ ये तीनों चीजें पॉसिबल है, सो यू कैन गो फॉर द फेमिस्टर grafting. And in this we stimulate the bone formation in already present fibrocartilaginous tissue bridging the fracture. and जो graft लेते हैं वो अपन cancellous bone से लेते हैं, iliac crest और fibula, and upper limb में you go for the olecranon, है ना. And these cancellous bone grafts are placed after raising the osteoperiosteal flaps around the fracture. मतलब फ्रैक्चर के अंदर जाना चाहिए, ऐसे नहीं फ्रैक्चर के ऊपर, नो, पेरियोस्टियम के अंदर जाना चाहिए. प्लस in addition to the femister graft we have another procedure that we do here, that is called as the patelling. पटेलिंग क्या होता है? तो फ्रैक्चर साइट्स के आसपास little cortical new bones are formed, है ना, and which hinder in the contact of the fracture surfaces. So with the help of instruments like we use a hammer and a chisel, and we remove these cortical bone attachments. So this is called as patelling. Okay, this is called as patelling. एंड फेमिस्टर ग्राफ्ट कैसा होता है? लेट मी सी. यहाँ पे दिस इज फेमिस्टर ग्राफ्टिंग फ्रॉम द इलियक क्रेस्ट से अपन ने ग्राफ्ट लिया कैंसलस बोन का, एंड हियर यू कैन सी फाइब्रोकार्टिलेजिनस है पहले से. सो जो ग्राफ्ट जो होता है ये आप पूरे 360 डिग्री में कंप्लीटली यू कवर दी फ्रैक्चर साइट पेरियोस्टियम के अंदर जाके विथ पटेलिंग. Also this is called femister graft. Okay, this is called as the femister graft. And the third technique that you can use in the treatment of non-union or delayed union is the Elizaro techniques that we have already discussed. Now second is the malunion. If the reduction is not proper, if there is any angulation or rotation after the reduction, it will lead to malunion. अगर बच्चा है तो बच्चे में तो जनरली और यंग एडल्ट्स में देयर इज remodeling and it will automatically gets corrected. But in adults, if there is great degree of malunion, you have to operate it, you have to manage it, you have to refracture it, put graft with plus minus internal fixation. Okay, now infection. Now third is infection, and infection is a complication. क्यों है major complication? We have already discussed, because they are most often associated with open injuries, and so it is common है infection, and due to this infection there is non-union of the tibia, है ना. So how you treat such infections and how you treat such injuries we have already discussed. Okay, now and for infected non-unions, which is the treatment of choice? Elizaro's method. Elizaro's method is the treatment of choice. Okay, नाउ वी कम टू कंपार्टमेंट सिंड्रोम. कंपार्टमेंट सिंड्रोम सबसे पहले याद रखना सिर्फ और सिर्फ क्लोज्ड केसेस के अंदर ही होता है, एंड दैट टू प्रॉक्सिमल और डिस्टल सेगमेंट्स के फ्रैक्चर में कॉमन होगा. एंड वी हैव ऑलरेडी डिस्कस्ड कंपार्टमेंट सिंड्रोम. इट इज अ विशियस साइकिल which will lead to hampering of the blood supply and the nerve supply, even causing the gangrenous changes. It is a grave emergency. And how do you clinically diagnose it? If there is pain out of proportion, यानी फ्रैक्चर के पेन से भी बहुत ज़्यादा अनबियरेबल पेन है, देर इज स्वेलिंग एंड एक्imosis हो जाएगा, है ना, गैंग्रीनस चेंजेस आने लग जाएंगे, टिंगलिंग नमनेस हो जाएगी टोज में, ओके, एंड you will not be able to feel the distal pulses, but that occurs very long after setting of the compartment syndrome. And if there is compartment syndrome, you have to release the pressure by doing urgent fasciotomy. ठीक है, decompression करना पड़ता है by urgent fasciotomy. Now injuries of vessels and nerves we have already discussed. Most commonly popliteal artery is the vessel which is most commonly injured, and the peroneal nerves, common and deep peroneal nerves, are mostly injured. Okay, so I have again told you many a times that koi sa bhi fracture ho, first of all you have to see the vessels and the nerves distal to that fracture. And कोई भी trauma का case है, there are two important x-rays जो आपको हमेशा कराने हैं. First is the chest x-ray and second is the x-ray of bilateral hip with pelvis. Okay, so this was about the tibia and fibula fractures. Now we'll come to another important topic, that is the ankle injuries. Okay, so एंकल जॉइंट जो होता है वो बेसिकली किससे बना होता है? यू हैव डिस्टली टिबिया, फिबुला एंड नीचे यू हैव द टेलिस. ओके, दिस इज the ankle injuries, and it generally occurs due to the bending or twisting forces, जिसमें it results in different kinds of fractures and the injuries to the ligaments, and all these injuries are accumulated under Pott's fracture. Okay, so Pott's fracture is fracture of ankle basically. And what is Pott's fracture proper? जो proper Pott's fracture होता है, that also we'll discuss in the coming slides. Okay, it is a modified hinge joint, and the socket is found by the distal articular surfaces tibia and fibula की, और इन दोनों के बीच में एक tibiofibular ligament होगा, and the articular surfaces of the malleoli, that is the lateral malleoli by the fibula and the medial malleoli by the distal talus. Up there is one term that is called as ankle mortise. Sorry, it is very important, especially for your viva examinations and also for your competitive examinations. Okay, so what is ankle mortise? Okay, what is ankle mortise? We'll discuss it. See, in normal AP view, anterior posterior view in an X-ray, you will not be able to see the entire joint line, नहीं दिखेगी, plus you will be not be able to see the tibiofibular joint. But if you go for this view which is also called as mortise view, and इसमें क्या होता है, इसमें आपको इंटरनल रोटेशन कराना होता है, किसका? फुट का, एट द लेवल ऑफ एंकल जॉइंट, और कितना डिग्री? 15 डिग्री. अगर 15 डिग्री इंटरनल रोटेशन ऑफ एंकल में आप एक्सरे कराते हो, इट इज कॉल्ड एज द mortise व्यू. एंड इन दिस mortise व्यू यू कैन सी पूरी joint line you can appreciate, plus you can easily appreciate this tibiofibular, distal tibiofibular joint and the posterior malleoli thoda bahut also. See here, there was overlapping, there is partial or little or no overlapping of tibia and fibula. So this is your mortise view and this is called as ankle mortise. So कोई भी ankle fracture हो, आपका जो बेसिक एम होता है दैट इज टू रिड्यूस द फ्रैक्चर इन नॉर्मल ankle mortise. Okay, this is your task. Now ligaments of the ankle, there are two main ligaments. First of all, deltoid ligament. We have discussed this ligament in the CTEB class on a special class, and deltoid ligament is also called as the medial collateral ligament, that is the deltoid ligament, and the other is the lateral collateral ligament. नाम से पता चल रहा है medial will be on the medial side यानी tibia की तरफ, and lateral will be on the lateral side, that is fibula की तरफ. The medial collateral or deltoid ligament has two parts. The first is the superior part, superficial part, which is tibiocalcaneal part, and the second is the deep part, which is subtalar के वहाँ पे, that is tibiotalar part. Okay, tibiotalar part. See here in this image, you can easily appreciate this is calcaneum and this is fibula, this is tibia, and here you will have the talus. Okay, and talocalcaneal and the tibiotalar, this will be your medial collateral ligament. So this is your lateral surface, so that's why we are not able to appreciate the medial collateral ligament here. Okay, now the lateral collateral ligament, it is weaker ligament as compared to the deltoid ligament, इसलिए the chances of injury of this lateral collateral ligament is more, and it has three parts, anterior and the posterior part, which is the talofibular ligament वाला part, talus and fibula के बीच में होगा. So and the middle part will be the calcaneofibular part. Here you can see talofibular inferior and talofibular inferior, posterior में ऐसा होगा, anterior में ऐसा होगा. Okay, so this is your ligaments. ठीक है, so deltoid medial collateral ligament and lateral collateral ligament. Lateral collateral ligament weak होता है तो ज़्यादा chances of injury are to in the lateral collateral ligament. Now there is another important classification here. So याद रखो कि आज अपन ने बेसिकली अभी तक दो क्लासिफिकेशंस पढ़े हैं. फर्स्ट जो टिबियल प्लेट्यू के लिए था, that was Katzger's टाइप, 6 टाइप में थे. And for the ankle fractures we have a special classification which is called as the log-Hansen classification. बस आपको नाम याद रखना है, that is log-Hansen classification, and it is based on the mode of the injuries कि इंजरी कैसे हुई है, and it is of 5 types: adduction injuries, abduction injuries, ठीक है, abduction injuries, that will be your pronation external rotation injuries or supination external rotation injuries. See, अगर ये है, so this will be this, ये आपका ग्रेड 2 मान लो, दिस इज योर फुट, दिस इज योर एंकल जॉइंट, तो ऐसे रहता है अपना. सो दिस इज योर सुपिनेशन, दिस इज योर प्रोनेशन, this is your adduction or internal rotation, this is your abduction and external rotation. So adduction, abduction, pronation and external rotation, supination and external rotation, and vertical compression injuries. Okay, so 5 type की injuries होती है of the ankle joint. So first is the adduction injuries, which is also called as the inversion injuries, क्योंकि इसमें inversion भी होगा. ठीक है, so अगर inversion injury हो रही है with foot in plantar flexion, अगर foot ऐसे है और inversion injury हो रही है, so क्या होगा, there will be sprain in the lateral ligament of the ankle. Okay, very acceptable, very easy कि अगर प्लांटर फ्लेक्शन है और अडक्शन हो रहा है, सो अगर फोर्सफुल अडक्शन ऐसे करोगे तो यहाँ से जो लेटरल लिगामेंट्स जाएंगे, लेटरल कोलेटरल लिगामेंट्स ऑफ द एंगल, देयर विल बी इंजरी. अगर पार्शियल है, you can go for the conservative treatment, and there is generally not 100% rupture of the fibers, and जो ligament यहाँ पे इन्वॉल्व होता है that is the lateral ligament, और उसका भी anterior जो talofibular part होता है वो. and if there is complete, तो entire lateral ligament, all of its three components will be affected. एंड इफ देयर इज अफेक्टेड, सो ये लिगामेंट क्या करता है, टैलस को जॉइंट में रोक के रखता है. सो इफ देयर विल बी कंप्लीट टियर ना, सो इट विल लीड टू डिसलोकेशन और सबलक्सेशन ऑफ द टैलस फ्रॉम द एंकल मोटिस. एंड अब यही अगर इन्वर्जन फोर्स जो होता है, ये प्लांटर फ्लेक्शन की जगह डॉर्सी फ्लेक्शन में अगर ऐसे फोर्स लगता है, सो अगर डॉर्सी फ्लेक्शन में लगता है, so it will result in the injury to the medial malleoli. okay, so बस आपको इतना सा ध्यान रखना है. एंड मोस्ट कॉमन इंजरी जो होती है वो यही होती है, दी अडक्शन और इन्वर्जन इंजरीज. अगर ये प्लांटर में होगा तो यहाँ पे लेटरल कोलेटरल लिगामेंट जो होगा उस पर जोर आएगा, सो उसकी इंजरी हो जाएगी. एंड इफ डॉर्सीफ्लेक्स में होगा, सो देयर विल बी इंजरी ऑफ द मीडियल मेलियोलाई. नाउ अबडक्शन इंजरीज, अगर आप अबडक्शन करोगे तो यहाँ पे ज्यादा स्प्रेन या प्रेशर आएगा, सो देयर विल बी इंजरीज ऑन द मीडियल साइड और मीडियल स्ट्रक्चर्स ऑफ द ankle. So the medial structures will be subjected to a distracting force and the lateral structures to a compressive force like this. So यहाँ पे distraction, यहाँ पे compression होगा. ओके, और मीडियल में डेल्टॉइड लिगामेंट होता है, तो मीडियल कोलेटरल लिगामेंट और डेल्टॉइड लिगामेंट का देयर विल बी इंजरी और रप्चर. and with this there can be avulsion, fracture of medial malleoli or talus also. okay, and on the lateral side क्या होगा, lateral malleoli का fracture भी हो सकता है lateral side. okay, now here you can see this is adduction and this is abduction. see, angutha or the great toe is your medial part, so here it is adduction and it is away from the great toe, so this will be your abduction. okay, now another form of injury is the third type of injury according to the log Hansen classification. okay, कौन सा classification, log Hansen classification. and this is pronation with external rotation injuries. okay, pronation external, so when a pronated head rotates externally, और यहाँ पे क्या हो रहा था, when there was plantar flexion. okay, this and this, and here it is external rotation with pronation. so when a pronated foot rotates externally, ओके, सो प्रोनेटेड फुट है, एक्सटर्नली रोटेट कर रहा है, तो यहाँ पे हियर आल्सो यू कैन सी द फर्स्ट स्ट्रक्चर जहाँ पे सबसे ज्यादा प्रेशर पड़ेगा, दैट विल बी ऑन द मीडियल साइड. ओके, सो प्रोनेशन, सो इसमें क्या होगा, देयर विल बी मीडियल मेलियोलाई का फ्रैक्चर. तो इसको याद कैसे कर रखोगे कि इसमें डेल्टॉइड लिगामेंट नहीं आ रहा है, ऐसे याद रखो कि जब भी इसको आप ऐसे प्रोनेट या डॉर्सीफ्लेक्स करोगे ना, सो द बोनी कंपोनेंट्स विल गेट फ्रैक्चर जस्ट लाइक इन दिस. प्लांटर में देयर वाज बोनी इंजरी नहीं हो रही थी जनरली, एंड इन द डॉर्सीफ्लेक्स देयर वाज बोनी इंजरी. ओके, सो जब भी आप प्रोनेशन में जाओगे, सो देयर विल बी बोनी इंजरी, एंड अगर एक्सटर्नली है तो सारा स्प्रेन या प्रेशर मीडियल साइड में बढ़ता है. दिस विल लीड टू फ्रैक्चर ऑफ द मीडियल मेलियोलस और अ रप्चर ऑफ मीडियल कोलेटरल लिगामेंट आल्सो. ओके, एंड इफ The tibiofibular syndesmotic joint is also disrupted. The fracture occurs above this syndesmosis also, that is in the distal 1/3 of the fibula, है ना. सो नेक ऑफ द फिबुला का जो फ्रैक्चर होता है वो भी इसके साथ एसोसिएटेड होता है इंजरीज ऑफ द एंकल के साथ, जिसको बोलते हैं बहुत इंपॉर्टेंट मेसोनीज फ्रैक्चर. हियर यू कैन सी देयर इज एंकल इंजरी with this dislocation and disruption of the ankle mortise, you can see. And if here it is, you can visualize this. So her fracture में you have to see the head of the or the proximal part of the fibula, और यहाँ पे you can easily see कि there is fracture of the proximal or the neck of the fibula, and this fracture is called as the Mason's fracture. This fracture is called as the Mason's fracture. Okay, understood? Very easy. Okay. Now, as I've told you, upon POTS and fracture proper, so bimalleolar fracture यानी दो मेल्यूलस का हुआ है. सो दिस विल बी पॉट्स फ्रैक्चर. हियर यू कैन सी टू मेल्यूला, लेटरल मेल्यूला एंड मीडियल मेल्यूला. जो पोस्टीरियर मेल्यूला होता है, इट इज विजिबल इन द लेटरल एक्सरे. दिस इज योर पोस्टीरियर मेल्यूला. सो एनी ऑफ द टू मेल्यूला बायमेल्यूला पॉट्स एंकल और पॉट्स फ्रैक्चर. एंड इफ इट इज ट्राइमेल्यूलर, all the three melluli, it is called as Orton's fracture. Okay, then it is called as Orton's fracture. Very important for your NEET PG also. X-rays या questions या which option is wrong, which of the following is correct, उसमें ये fractures generally आते हैं. Okay, so it is important. Now next injury here, it is the इसका उल्टा. प्रोनेशन में एक्सटर्नल रोटेशन का देख लिया आप. सुपिनेशन के अंदर एक्सटर्नल रोटेशन अगर होगा, सुपिनेशन में एक्सटर्नल रोटेशन होगा, so the talus will twist externally within the mortise, so there will be fracture at the level of ankle mortise. Okay, so इसमें ध्यान रखना. सो एंकल मोटिस के लेवल पर ही होगा. देयर विल बी स्पाइरल फ्रैक्चर एंड पोस्टीरियर मेल्यूलाई का फ्रैक्चर होगा, बट द टिबियोफिबुलर सिंडेस्मोटिक विल रिमेन इंटैक्ट. सो टू थिंग्स याद रखनी है आपको. सुपिनेशन के एक्सटर्नल रोटेशन इंजरीज में पोस्टीरियर मेल्यूलाई फ्रैक्चर होगा एंड द टिबियोफिबुलर सिंडेस्मोटिक विल बी इंटैक्ट. तो अगर वो इंटैक्ट रहेगा तो एंकल मोटिस के अंदर ही फ्रैक्चर होगा. बट हियर द टिबियोफिबुलर सिंडेस्मोसिस वाज आल्सो इंजर्ड. सो अगर ये इंजर्ड होगा तो इसके ऊपर भी फ्रैक्चर चला जाता है, डिस्टल 1/3 और इवन टू द प्रॉक्सिमल फिबुला, लाइक इन द मेसोनीज फ्रैक्चर. Okay, understood. Now the last is the vertical compression injuries. Okay, and it is नाम से ही very evident है कि there will be vertical force either in the anterior side or the posterior side, which will lead to the fracture of tibia. And यहाँ पे एक special unique fracture होता है due to the vertical compression force, and that is the Pilon's fracture, which is intra-articular fracture of the distal tibia with fracture of fibula. So this is your Pilon's fracture. So this is your Pilon's fracture. Okay, understood. Vertical force की वजह से या vertical compressive force की वजह से होता है. Okay. Now the clinical features, वही same clinical features होंगे. History of twisting or bending force or slip and fall correlating with the clinical features with, and then correlating all of this with the X-ray and the CT findings. Okay, very easy. Now ankle series, I have already told you, this is your AP, this is your mortise, 15-degree internal rotation mein entire joint line and no overlapping of this tibia and fibula, and this is your lateral part, lateral view. Okay, so ankle joint का कोई भी injury हो, you have to go for these very sorry, you have to go for these 3 ankle x-rays. नाउ ट्रीटमेंट जो होता है वो सबसे पहले डिपेंड करता है कॉम्प्लेक्सिटी ऑफ द इंजरीज में. इफ इंट्रा आर्टिकुलर और जॉइंट इज इन्वॉल्व, इफ देयर इज सबलक्सेशन और डिसलोकेशन ऑफ द टेलस और इंट्रा आर्टिकुलर टिबिया और फिबुला फ्रैक्चर, तो you have to go for the operative. ओपन है, you have to go for the operative. Isolated medial malleoli का fracture है, so it is an indication for the surgery. Okay, सर्जरी करनी ही पड़ती है because it is the weight bearing part and also यहाँ पे precarious blood supply होती है malleoli के. But if there is isolated fracture of lateral malleoli or distal fibula, you can go for the conservative. So ये मैं आपको पहले ही rule of the law बता रहा हूँ. और अगर इंट्रा आर्टिकुलर फ्रैक्चर है और if there is dislocation with fracture, you have to go for the, और if internal fixation आपको करना ही पड़ेगा. एंड द बेसिक प्रिंसिपल जो होता है इसका, we have already discussed. The basic principle of is to form the ankle mortise again or to restore this ankle mortise. Okay, now here are general principles, like if fracture is without displacement and non-intra-articular, just below knee cast will be good for like 3 to 6 weeks, follows of physiotherapy and bracing and weight bearing. If it is with displacement, you have to maintain the ankle mortise, which is possible by the operative techniques. You have to go for the internal fixation. So what are the different operative methods we use? For medial malleoli fracture, we can go for K-wire or screw and TBW tension band wiring. For fracture distal fibula, you can go for plating or K-wire. And for talus, you have to first relocate the talus and then you can fix it by the corticocancellous screws or the Herbert screws. Okay, understood? Very easy. Okay, now ऑपरेटिव रिडक्शन करना बहुत जरूरी होता है. ओके, suspects. Now internal fixation by operative reduction. Okay, so here are some techniques, like for medial malleoli we have discussed. You can go for the screw, the tension band wiring. If it is oblique, the screws again, or if it is avulsion, tension band wiring के लिए आप you can go. Okay, and for the lateral malleoli fractures के लिए also you can go for the tension band wiring or the screws or plating. Okay, and for the posterior malleoli, इसके लिए क्या करते हो? For the posterior malleoli you have to go for the screws or the K-wire or the Kushner's wires. Okay, now if the fracture is involving less than 1/3 of the articular surface of the tibia, then no additional treatment is required. If more than 1/3 of the articular surface is involved, then you have to go for the screws and ORIF or internal fixation. एंड टिबियोफिबुलर सिंडेस्मोटिक जॉइंट का भी डिसरप्शन हो जाता है. सो यहाँ पे यू हैव टू पुट अ लॉन्ग स्क्रू टू मेंटेन दिस जॉइंट एंड दिस स्क्रू इज कॉल्ड एज syndesmotic screw. This screw is called as the सिंडेस्मोटिक स्क्रू, एंड ये ध्यान रखना हमेशा कहाँ से, फिबुला टू टिबिया के डायरेक्शन में डालते हैं, दैट इज लेटरल टू मीडियल। और एक और चलो एक रूल ऑफ लॉ बताता हूं, इन लोअर लिम you always open fracture site from the lateral side only, lateral side से ही ओपन करोगे, medial side से ओपन नहीं करोगे। why? because lateral side में vessels and nerves बहुत कम आती है, यहाँ पे आती ही नहीं है, so it is more safer, understood? okay, now अब आप बोलोगे कि द लिगामेंट्स का क्या करोगे सर? सो लिगामेंट्स आर आल्सो रिकंस्ट्रक्टेड बाय आर्थ्रोस्कोपी, और if the exposure is correct you can reconstruct the ligament during that surgery only. Now conservative methods अपन को पता है कैसे करना है, कब करना है, what are its गाइडलाइंस या व्हाट आर इट्स इंडिकेशंस, यू ऑल नो नाउ, एंड कितने वीक्स तक रखेंगे, कौन कौन से कास्ट रखेंगे, देन हाउ you have to do the check x-ray, you have to go for the physiotherapy and the brace etc. Now external fixation, external fixation if it is a compound na or open, you have to debride it and you have to reduce this joint, because if you will not reduce the joint or the dislocated talus na, it will go into osteoarthritis and then fix this reduction in external fixator. Okay, then when the skin condition and the wound condition is like that to the close fracture, then you can go for the definitive surgery. Now complications, the most serious complication is osteoarthritis और joint function का disruption due to improper reduction of the fracture dislocation. Okay, so stiffness of the ankle जो होती है, that is the most serious and most common प्रॉब्लम, एंड इसको ठीक करने के क्या क्या तरीके हैं या प्रिवेंट करने के क्या क्या तरीके हैं? फर्स्टली प्रॉपर रिडक्शन, एंड ऑल्सो रिडक्शन के बाद प्रॉपर मेंटेनेंस ऑफ दिस रिडक्शन, ईदर बाय प्रॉपर चेक एक्सरे एंड कास्ट और बाय द इंटरनल फिक्सेशन एंड बाय प्रॉपर फिजियोथेरेपी. Okay, so this is very important. Okay, now osteoarthritis क्यों होगा, कैसे ठीक होगा, we have discussed this already. Okay, now there is a term which is called as sprained ankle. So sprained ankle is basically a non-bony injury. It is a injury to the ligaments of the ankle, and sprain is basically rupture of ligament fibers, and if 100% fibers are ruptured, it is called as complete sprain or a tear. Okay, remember this thing. So अब अपन ने पहले ही डिस्कस कर लिया है, अगर इन्वर्जन इंजरी होगी और या अबडक्शन इंजरी होगी एंड अडक्शन इंजरी होगी तो कौन से ligaments will be sprained. Okay, so eversion होगा तो medial collateral ligament, और अगर inversion होगा तो lateral collateral ligament will be sprained. Now see, just don't ratify things. All things जो हो रहा है ना उसके पीछे भी एक लॉजिक है. अगर इंटरनल रोटेशन या अडक्शन होगा तो प्रेशर यहाँ पे आएगा, सो यहाँ पे इंजरी होगी, क्योंकि ये जो लिगामेंट है इसी पे ही force आएगा, there will be the distraction force here. Okay, see, so sprained ankle में क्या होगा, bones are not fractured, so x-ray में visible नहीं होगा ये, so you have to clinically correlate it. And कैसे करोगे, सबसे पहले there will be lot of pain and marked swelling, and the patient will not be able to do the weight bearing on the ankle joint. Okay, weight bearing will give rise to excruciating pain, or weight bearing will not be possible. So इसमें क्या करना है, you have to suggest bed rest, immobilize कर दो limb को by a cast or a slab, below knee cast or slab will do, immobilize it, give rest, give anti-inflammatories, pain and swelling ज़्यादा है, go for the cold fermentation and go for the MRI, so that you can see कि कहाँ पे कितने level of tear है. So if a torn ligament is subjected to stress na by examination, okay, by different maneuvers or by weight bearing, he or she will have severe pain. Okay, so inversion of a plantar flex foot for anterior. Okay, अब we'll discuss कि कौन से लिगामेंट की इंजरी को चेक करने के लिए अपन कौन सा टेस्ट करेंगे या कौन सा मूवमेंट करेंगे. सो इट इज वेरी इजी. लेटरल वालों को चेक करने के लिए आपको क्या होगा, लेटरल यू हैव टू पुल द और यू हैव टू गिव स्ट्रेस टू द लेटरल लिगामेंट लाइक डूइंग द अबडक्शन और द इंटरनल रोटेशन. एंड इन्वर्जन अगर आप करोगे, सो इन्वर्जन करने में यू आर चेकिंग दिस ligament, and inversion on a plantar flex foot karoge, so you are checking lateral collateral ligament, and that too its anterior tibiofibular part. And inversion in a neutral or dorsiflex position में क्या होगा, neutral position में the entire lateral collateral ligament, and if you do the inversion in neutral position you will check the medial collateral ligament. ओके, सो आप अपने लेवल पे सिर्फ इतना याद रखो, इन्वर्जन करोगे सो यू विल चेक द लेटरल कोलेटरल लिगामेंट, इवर्जन करोगे तो यू विल चेक द मीडियल कोलेटरल लिगामेंट. ओके, सो एज आई हैव टोल्ड यू, एक्सरेज आर यूजुअली नॉर्मल स्प्रेन के अंदर, बट यू कैन गेट अ टिल्ट इन द टेलस. अगर आप फोर्सफुल इन्वर्जन और इवर्जन करा के उसी पोजीशन में यू विल गेट द एक्सरे डन ना, सो देन यू विल सी कि देयर इज अ टिल्ट इन द टेलस if there is sprain in the ligaments of the ankle. So treatment depends on the grade of the ligament injury, and it is on the basis of the percentage of the fibers that are ruptured or injured. Okay, so if it is grade 1 for 2 weeks, grade 4 4 weeks, and grade 3 6 weeks, not at all a use to you. Okay, just it is for the prof examination देने वाले बच्चों के लिए कि पेज कैसे भरना है. So I am मेरी हर स्लाइड में हर फ्रैक्चर में you will get a systematic thing कि फर्स्ट ऑफ ऑल कोई भी शॉर्ट नोट पे फ्रैक्चर आया तो फर्स्ट ऑफ ऑल शॉर्टली यू हैव टू राइट द एनाटमी. okay, then you have to go for the mechanism of the injury, then you have to go for the signs and symptoms, clinical features, the radiological finding, if there is any classification associated with it, then you have to go for the treatment, conservative है, undisplaced है, displaced है, open or compound, then you have to go for the complications. Okay, so in a well structured form, if you learn, you will also know how to frame your answers also. Okay, now as we have already discussed, treatment में rest, ice packs, compression and elevation, that rise thing, rise for rest, or by splint, I for ice, C for compression, and E for elevation. for initially 2 to 3 days. Then a structured manner में you start the physiotherapy, and physiotherapy is done in such a way that movement हो joint पे, but that ligaments that are sprained उन पे stress ना हो. Okay, so what is chronic ankle sprain? It is very common. Many patients come to our OPD daily ki yes, we have chronic ankle sprain. So chronic ankle sprain जो होता है इसमें क्या होता है, if you don't rest initially जब इंजरी होती है acute इंजरी में, if you don't take proper rest and you don't follow the suggestions of your doctor, then there is incomplete healing of the ligaments which will lead to the chronic ankle sprain. So best MRI is the investigation of choice and physiotherapy is the treatment of choice. But if it is very much hampering your day-to-day lifestyle, and if the pain is very excruciating, you can go for the arthroscopic surgery also. Okay, now there is a common reason for pain in chronic ankle sprain, and that reason is due to impingement of the scarred capsule or chondromalacia of the talus. Okay, talus के जो attachment point होते हैं in sprained ligaments के, at that there they will impinge, or there will be fibrous tissue forming around them, so this will lead to pain. Okay, now we come to the fracture of the calcaneum. So fracture जो calcaneum forms the heel part of our foot. Okay, and the upper surface it articulates with the talus, or the upper or the proximal surface, and the distal surface होते it articulates with cuboid. Okay, it articulates with the cuboid. ठीक है, this is the proximal, this is the distal part. So proximally में there will be talus, distal में there will be cuboid, and अगर अपन 3D में देखें तो नीचे की तरफ the inferior there will be a prolonged surface there which is called as the tuber calcanei. Okay, tuber calcanei, and there is an angle between the talus and the calcaneum which is also called as the kite's angle or the talocalcaneal angle. So आपको बस इतना ही याद रखना है कि kite's angle क्या होता है, talocalcaneal angle होता है. Okay, and if there is fracture of calcaneum, this angle will be reduced. Commonly it is between 30 to 35 degrees, and it is reduced in case of fractures of calcaneum. Okay, and most common mechanism for fracture of calcaneum, you can easily understand or correlate कि क्यों होगा. calcaneum heel है, so heel पे का fracture कब होगा, जो heel पे pressure पड़ेगा. heel पे pressure सबसे ज़्यादा कब पड़ता है, when you are standing or you are jumping. So fall from height is the most common cause of fracture of calcaneum. और so if height से गिरा है, so bilateral calcaneum fractures are very common. Okay, so there can be an isolated crack fracture. Okay, or if there is compression injury, so there will be टुकड़े टुकड़े हो जाएंगे, और that will called as the commutated fracture like an eggshell. Okay, now see, this is your talocalcaneal angle between the calcaneum and the talus. Okay, that so this is not the talocalcaneal angle, is like this. Okay, and there is another angle which is called as the polar angle, in which a line is passed through the horizontal surface, lateral x-ray में horizontal surface of the calcaneum to the inferior most surface of the talus, and here you'll see a line which is forming an angle. This is called as the polar angle, and normal ये भी around 20 to 40 degrees ही होता है. ओके, सो एक्स्ट्रा आर्टिकुलर फ्रैक्चर है यानी जॉइंट स्पेस को इन्वॉल्व नहीं कर रहा है. द आर्टिकुलर सर्फेसेस आर इंटैक्ट. ओके, एंड इंट्रा आर्टिकुलर फ्रैक्चर्स where the articular surface of the calcaneum fails to withstand the stress. So as a rule of thumb, again I'll tell you one thing, ki operative or not. So basically, what are the indications to go for the surgery in case of calcaneal fractures? First and foremost, if it is intra-articular, and you have to go for the CT scan, the 3D CT scan, and you have to see the dislocation of the talus, you have to see the subtalar joint and the talocalcaneal joint. Mostly the subtalar joint you have to see. Okay, see here, you can see here there is dislocation, this is intra-articular, and there is fracture of the calcaneum, so this is operative. Okay, and second is if it is compound, then you have to debride it, then you can keep it as it is, because calcaneum ऐसी बोन है जिसमें you should avoid surgery as much as possible, because the blood supply is very less here, so healing is very delayed and healing is not good. Okay, now the diagnosis. क्लिनिकल डायग्नोसिस कैसे करेंगे? सेम क्लिनिकल फीचर्स, हिस्ट्री को कोरिलेट करना है, द साइंस एंड सिम्टम्स एंड द क्लिनिकल फीचर्स ऑफ द पेशेंट विद द फाइंडिंग्स ऑफ द एक्सरे. नाउ एक इम्पॉर्टेंट बात जो आपको पता होनी चाहिए, दैट इज दैट इन द फ्रैक्चर कैल्केनियम द एंकल जॉइंट प्रॉपर के जो मूवमेंट्स होते हैं, they are not impaired markedly. Okay, why? Because we have already discussed that basically the ankle joint is formed between the talus, tibia and the fibula. Okay, many cases of compression fractures of the calcaneum are associated because, see, imagine if any person falls from a height like this, so there will be compression force. सबसे पहले वो heel पे land किया तो heel पे compression force आया, that got fractured, but that compression force will also be transferred to the entire body, firstly to the pubic rami, so you have to check the pubic rami also, then to the vertebral column, and also the cervical column here, especially the atlantoaxial injury you have to look for there. In case of fracture of calcaneum, if there is precarious history of fall, and especially if there is bilateral fracture of calcaneum. एक्सरे में क्या दिखेगा? एक्सरे में calcaneum को you appreciate करने के लिए you have to go for the lateral view of the ankle joint as well as the foot. Okay, treatment, like we have discussed many a times, if it is undisplaced, below knee cast for 4 to 6 weeks. Okay, and if there is compression fractures, है ना, compression fractures है तो mostly it is comminuted fracture, and if it is not properly reduced and healed, it will result in permanent impairment of the functions. Okay, so the foot is elevated in this below knee slab for 2 to 3 weeks. Okay, foot को आपको क्या करना है, elevated करके रखना होता है to remove the swelling. Because एक और खास बात होती है calcaneum fractures की. The calcaneum fractures are associated with increased swelling. So to avoid this, the foot has to be elevated at least 2 pillows. Just like such type of swelling is also more common in fractures of proximal tibia or the distal tibia or the both bone forearms. Okay, so now, as we all know, according to the new guidelines, more towards surgical reconstruction ki taraf there is trend. And if it is intra-articular and heavily displaced, you have to go for the surgeries, and surgery can be done by plating or screws. Okay, but we know that blood supply बहुत poor होती है, so it depends on the experience of the surgeon also. Okay, so complications, joint के बहुत पास है bone, so there will be most common complication with be stiffness of the joint, mostly basically subtalar and the mid tarsal joint. Okay, and physiotherapy is the treatment of choice, and it will be associated with osteoarthritis. Okay, अगर ज़्यादा है so you have to go for the surgery like arthrodesis, fusion कर दो joints का, or you can go for the arthroscopy also, or you can go for the internal fixation also. Okay, now fractures of the talus. See, first of all, this is your tibia, this is your calcaneum, and this is your talus. This is the part of the talus called as the body. This is the head. Okay, and these are your other tarsal bones. Okay, this is your navicular, and this is your cuneiform. Okay, so this. So talus fractures are associated with ankle injuries. Okay, so the most common and the most serious fracture of the talus जो होता है, talus का most common and the most serious fracture is the neck of talus fracture. See in this image also there is fracture of the neck of the talus, which is most common and most serious also. ठीक है. Now there is also a important thing about the blood supply of the talus that you should know, and this is that it is the only bone of the foot which has no muscle attachment. Okay, it is only bone which has no muscle attachment. It has lots of ligaments का attachment but no muscle attachment. So इसकी वजह से क्या होगी, there will be very less blood supply, so the healing is very less. So talus fracture is very hard to manage. ठीक है, बहुत हार्ड होता है इसको मैनेज करना. ठीक है. So therefore blood supply to the body of the talus is often cut off following fractures occurring through the neck. Now neck fractures most serious क्यों होता है, क्योंकि neck fractures will cut off the blood supply. And why? Because the main blood supply is due by the anastomosis, which is formed by the vessels which enter through the neck. Okay, so neck से ही अगर blood vessels ज़्यादातर आ रही है, so the fracture neck will be the most serious because it will hamper the blood supply of the talus. Okay, now mechanism, how fracture neck of the talus occur, and it generally occurs due to forced due to force dorsiflexion of the ankle like this. अगर dorsiflexion of the ankle करोगे so उसके साथ में it will associated with the forced dorsiflexion of the ankle. Okay, now there is a special fracture which is called as aviator fracture. We have discussed this in our introductory class. Okay, and why it is called aviator fracture? Because it is associated with aircraft crash. Okay, it is associated with the aircraft crash where there is force dorsiflexion resulting in fracture of the talus. Okay, now diagnosis, we all know. Treatment बता ही दिया. If there is dislocation, you have to relocate it either by close reduction, which is very difficult. You have to do it by open reduction only. Now complications, as we have discussed, बहुत blood supply will be hampered in its fracture, so avascular necrosis is very common, and also non-union or delayed union is very common. Okay, and stiffness and osteoarthritis के chances भी बहुत होते हैं due to its proximity to the joints. Now injuries to the other tarsal bones, they are very less common, and mostly they are managed conservatively by casts and slabs. Okay, see, these are your tarsals. We have, this is the calcaneum, so this is the talus, this is your medial part, this is your lateral part. calcaneum cuboid के साथ आती है, talus navicular के साथ आती है. Okay, and here you have medial to lateral 3 cuneiforms in medial, intermediate and the lateral. Then you have the cuboid, calcaneum, talus and the navicular. You have these 5 metatarsals and the phalanges, and the first metatarsals have here 2 sesamoid bones. Okay, यहाँ पे sesamoid bones होती है. See in the lateral, you can see this is calcaneum, talus, navicular, cuboid. 2 cuneiform सी दिखती है आपको lateral view में. कौन कौन सी? Lateral plus intermediate in or intermediate. Okay, see. Now fractures of the metatarsal bone, इसमें सबसे important जो है आपको basically नाम वाले fractures याद रखने हैं, and most important is one type of stress fracture which occurs due to repetitive trauma, बार बार trauma होने की वजह से, and that is a march, called as march fracture. Fracture of second or third metatarsal का shaft ही होता है almost. Managed conservatively by slab और cast, and इनके लिए special कौन सी चप्पल्स cast लगाते हैं. कौन सी चप्पल cast लगाते हैं. Easy to remember, march fracture. Okay, now fracture at the base of the fifth metatarsal को क्या बोलते हैं? Jones fracture बोलते हैं. Jones fracture बोलते हैं. Okay, just remember by the name. See, this is your Jones, this is your Jones fracture. Okay, now metatarsal shaft का fracture जो होता है, that is march fracture. और stress of fatigue fracture we have already discussed. जो march past करते हैं especially the army personals, उनमें होता है due to repetitive trauma, and they are very hard to detect on x-rays. But if you see closely ना, I don't know whether you will be able to appreciate, but here this is a hairline fracture. Okay, now fractures of the phalanges and toe हो सकता है, and the most commonly will be the great toe. You have to put the chappal slab here, or the chappal cast can be managed conservatively. Okay, sorry. So this was all about the lower limb orthopedics. We have completed our lower limb. Only 2 things of the lower limbs is left. First is its nerve supply and the vessel supply. And second, we haven't discussed the ligaments and the injuries of the knee joint. That is very important and very confusing also. So okay, so we'll discuss them in the next lectures. Tomorrow I have a very important special class scheduled. Okay, very important special class tomorrow, and due to some hospital duties I have to change its timings. Okay, it is now at 10 p.m. tomorrow, and it is on bone tumors. Okay, and at least one or two questions in your NEET PG every time you get from this topic, very important. Okay, so for getting a part in this special class, you just need to download the app and you need to subscribe using this code. And mind you, the subscription and the app for this special class, both of it are absolutely free. You just go for the free subscription and attend the special class. They are very good, not of me but also of the other educators. So see you tomorrow in the special class, and thanks for watching. I hope you like the video. If you like the video, kindly like, share and subscribe. Go for the planned subscription, paid subscription, and use this code. And I would suggest you to go for our 1 month rapid NEET PG subscription, which is very good. Okay, you will get everything that you will need for the last 1 month preparation for your examination. So stay healthy, sleep अच्छे से, okay, eat healthy, don't take stress, just hold on, the time will pass and you'll enjoy it in your PG very much. Okay, your post graduation time you'll enjoy it बहुत सारा. Okay, so just hold on, पढ़ते रहो, go for questions, just revise.